Today we are going to talk about gastrointestinal changes or GI changes and how to manage these side effects. The first side effect we will be discussing today is constipation. Constipation is when one has infrequent bowel movements, when stool may be hard to pass, dry, and can cause stomach cramps, bloating, and nausea. Some reasons for constipation include taking certain medications, such as chemotherapy, anti-nausea medications, opioids, iron supplements, and diuretics. Changes in diet such as inadequate fiber, consumption, or not drinking enough fluids, as well as cancer itself, such as if a tumor is pressed up against the digestive tract or being less active, all contribute or cause constipation. Some interventions you can do at home to treat constipation are to eat high-fiber foods such as raw fruits and vegetables and whole grains, drinking plenty of fluids. It is advised to drink 8 to 12 cups of non-caffeinated liquids daily, such as water, juice, milk, soup, or jello, and to drink warm or hot liquids to stimulate the bowels to move. Being active every day can be beneficial for constipation. This would include moderate exercises such as walking, dancing, or swimming for about 30 minutes each day. There are certain precautions that you need to be aware of, such as avoiding excess use of laxative or stool softeners, as your body may expect or need them in order to continue to have bowel movements. You should avoid rectal agents and or manipulation if your blood counts are low. Examples of these are enemas or suppositories. Doing so can result in infection or damage to the rectum and bleeding. Always tell your doctor if you are experiencing constipation, as it may be a sign that something else is going on. You should call your provider if you have any unresolved constipation or constipation with other associated symptoms, which can include abdominal cramping or pain or a feeling of abdominal fullness. You should keep track of how often you have a bowel movement and whether it is hard or soft. You should also be aware of how much liquid you are drinking daily. Again, the recommendation is to try 8 to 12 cups of non-caffeinated fluids daily, or as advised by your doctor. If you find that you are having issues with constipation, there are interventions that we can assist to help you, such as having you speak with a registered dietitian to recommend helpful foods. Speaking with your physician before trying to take medication may be needed if you are having issues with constipation. Next, we're going to talk about diarrhea and how to manage its side effects. Diarrhea is when a person has bowel movements that are soft, loose, or watery more than 3 times per day. If you are having issues with diarrhea, you may want to avoid beverages that are very hot or cold, alcoholic drinks, caffeinated or carbonated drinks like tea, soda, and coffee, prune, orange, and grapefruit juices, spicy, greasy, or fried foods, foods high in fiber, dietary supplements such as Ensure, and dairy products. You may want to drink 8 to 12 cups of fluid or more per day to avoid dehydration. Eat a BRAT diet, which is bananas, rice, applesauce, and toast, and low-fiber food choices. You should call your provider if you have any diarrhea, feeling dizzy or lightheaded, have dark yellow urine or are not urinating, or have a fever of 100.4 or higher. You should always check with your provider before taking any medications. Keep your rectal area clean and dry, as diarrhea can cause irritation, and use interventions such as pat drying versus wiping, using a sitz bath with baby shampoo and warm water to soak your rectal area, use a spray bottle to clean your rectal area with warm water, or use a hairdryer on a cool setting to dry your rectal area to avoid irritation. Diarrhea can lead to dehydration and low levels of salt and potassium. If you have any questions regarding diarrhea and how to best manage these symptoms, please call the Nurse Advisor line at 320-229-4989. You should speak with your healthcare team about causes of diarrhea, what symptoms you should call about, how much liquid you should be drinking each day, and if you would like to speak with a registered dietitian to learn more about best foods and drinks, as well as medicine and steps that you can take to prevent diarrhea and to lower rectal pain. Our final discussion will be about nausea and vomiting and how to manage these side effects. Nausea is when a person feels sick to their stomach, and vomiting is the act of throwing up. These symptoms can lead to more serious issues like malnutrition and dehydration. If you are experiencing these symptoms, please call the Nurse Advisor line to speak with a nurse. That number again is 320-229-4989. Steps you can take to combat nausea and vomiting include taking your anti-nausea medications as prescribed and drinking plenty of liquids. Try sipping on things like water, fruit juices, ginger ale, tea, and sports drinks throughout the day. Avoid greasy, fried, sweet, and spicy foods. Acupuncture, aromatherapy, and healing touch are options through integrative therapy. Other techniques to try include using deep breathing, guided imagery, hypnosis, listening to music, meditation, or reading a book. You should speak with your healthcare team to discuss ways to optimize your anti-nausea medication, when you should seek out medical attention, and if you would like to speak with a registered dietitian or if you need a referral to a GI specialist. There are multiple resources available if you are having any symptoms or side effects, such as meeting with an advanced practice provider or dietitian, scheduling integrative therapy, meeting with palliative care providers, rehabilitation services, physical or occupational therapies, or home care services. You will find in your oncology rehabilitation book the following patient guide to assist you with dealing with any of the GI symptoms we have spoken about, and techniques and interventions you can use with phone numbers to call if you have further questions or concerns.